Hello, everyone. My name is Hyoki Lee, and I camp in Baylor College of Medicine. The subject of this presentation is to give you one of my research ongoing project at iCamp. I'll talk about an application of wearable technology for enhancing performance in surgical residents. As previous presenter mentioned in this morning, iCamp is performing many collaboration projects focused on application of wearable technology. Among these many applications, I will talk about the wearable technology in clinical area for surgical residents. Now, let's begin the presentation by asking you a question. Can a wearable device assist for enhancing the surgical performance in residents during the surgical training course? As a background, I'll present briefly about the laparoscopic surgery. This is as a modern surgical technique. It's called minimal invasive surgery. During surgery procedure, as you can see, small incisions are made, and plastic tubes are placed through these incisions. So there are a lot of advantages to the patient, such as lesser pain, lower complication rate, and shorter hospital stay than conventional open surgery. Recently, simulation-based training has gained popularity for education of surgical residents. This laparoscopic surgery is also performed for simulation-based training of the resident. Also, I'd like to discuss about stress on surgery. We often feel stress during our daily lives. Surgeons, as well as surgical residents, are no exception. Surgical residents experience increased levels of symptoms associated with stress during residency. The laparoscopic surgery training in surgical residents leads to stressful condition because the procedure requires physically, emotionally, and intellectually perceptual motor challenges. This stress may affect their surgical performance, patient health outcomes, including quality of care, patient safety, and health of surgeons. There are two numbers regarding stress in surgeon. 24.3 is the prevalence of burnout among residents in surgical specialties. 40% of surgeons indicated that they had witnessed directly an intraoperative complication related to surgeon stress. Therefore, management of potentially deleterious stress in surgical residents is important for safe surgical training and enhancing their surgical performance. How can we assess the stress? Conventionally, the stress can be assessed by questionnaire or interview-based approach, but these methods are subjective. Another method is to measure cortisol level by salivary or blood test. This method is pretty objective. However, it requires interrupting subject from their task to collect samples. That is, these two conventional methods are not practical for assessing stress in residents and for tracking changes of the stress continuously. Recently, a method for assessing stress was suggested. There is an evidence that the heart rate variability is associated with physical stress response. For example, the stress can stimulate the sympathetic nervous system because of a physiological stress response, and then it may make increasing of heart rate and decreasing of heart rate variability, such as RMSSD. That is, in other words, reducing stress is related to reducing heart rate and increasing heart rate variability. In this study, we'll assess the physiological stress response by measuring heart rate and heart rate variability. And for extracting easily heart rate variability, we used the wearable technology. So the aim of these studies are to propose the usage of a wearable technology for assessing physiological stress response during a laparoscopic training course in surgical resident, and to examine its association with resident surgical performance. In this study, as a proof of concept study, eight residents participated in 2 consecutive days for laparoscopic surgical training course in the animal lab. During 2 days, each resident performed their procedure repeatedly. The video is an example of the laparoscopic surgery training using a pig as a simulation-based surgical training. The surgical performance was assessed using validated assessment tool based on questionnaire. After surgery, faculty assessed the resident performance, and each resident also assessed their own procedure for the self-assessment. For assessing physiological stress response, the wearable device was attached to the skin on chest. The used wearable device is a G4 bioharness. From this device, we can collect EKG data. Using this EKG data, we analyze mean heart rate and heart rate variability parameters. We used representative 2 heart rate variability parameters, SDNN and RMSSD. We compared the association between the ratio of changes of heart rate variability parameters and the ratio of changes of surgical performance. Please look at this graph. It shows an association between heart rate variability and the surgical performance. Regarding the blue line, the surgical performance was assessed by faculty. The change of surgical performance is significantly positively correlated with the changes of heart rate variability, which is especially in RMSSD measures. It indicates that increasing surgical performance related to increasing RMSSD. As I mentioned earlier, increasing heart rate variability is related to reducing stress. That is, increasing performance is related to increasing surgical performance is related to reducing stress. Additionally, we compared 2 groups according to faculty's assessment. One group is that their performance was increased. Another group is that their performance was decreased. There is a significant difference of heart rate variability between these groups, especially RMSSD. We observed that monitoring RMSSD could be used as a key parameter for managing resident stress. The result may suggest that the key factor is the ability to quick recover stress and relax. In summary, this proof of concept study demonstrated the association between resident surgical performance and physiological stress response. The method enables us real-time, unobtrusive, and unsupervised monitoring of resident performance. The results are promising and may open new avenues for identifying objective parameters to improve surgical training. Therefore, wearable technology may be used to enhance the resident surgical performance by managing their physiological stress response. We use a wearable device which can measure a 3-axis acceleration data as well. So we may be able to assess the economy of motion in resident during surgical training course, and then we will be able to design integrated tools for assessing surgical performance more accurately. Thanks to collaborators for this study. Thank you.